My name is Mike Jackling, and I'm a Medicare consultant with Pro Benefits of Washington, a capital benefit group company. Welcome to our Medicare 101. Let's get started. Medicare as easy as 1, 2, 3. In the coming slides, we will learn about Original Medicare, explore Medicare options, and provide you valuable information to help you choose a plan that will best serve you. Let's begin with Original Medicare. Who qualifies? And what is it? Who qualifies for Medicare? Citizens of the United States or a permanent resident for 5 consecutive years who are 65 and older, under 65 with a disability, and have been receiving 24 months of Social Security disability income. And individuals at any age who have certain disabilities, individuals who have end-stage renal disease or ALS or Lou Gehrig's. Medicare has 4 parts. Part A is hospital insurance. Part B is medical insurance. We call Medicare A and B Original Medicare, and it is administered by the U.S. federal government. Medicare Part C and Medicare Part D are offered by private insurance companies approved by Medicare. Part C combines the benefits of Part A and Part B and any additional benefits private plans may include. Part C is also known as Medicare Advantage. Part D covers prescription drugs. Medicare Part A is hospital insurance. What does it cost? You usually don't pay a monthly premium for Part A coverage if you or your spouse paid Medicare taxes while working at least 40 quarters or 10 years. Those who have credit for working 30 to 39 quarters, the standard Part A premium in 2023 is $278. And for those who worked and paid Medicare taxes for fewer than 30 quarters, the standard Part A premium in 2023 is $506. What does Part A cover? It helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Your share of the Part A costs in 2023: a $1,600 deductible for days 1 through 60 for each benefit period, $400 a day copay for days 61 through 90 of a hospitalization, $800 a day copay for days 91 through 150 of a hospitalization, skilled nursing facilities at $200 per day copay for days 21 through 100. Medicare Part B is medical insurance. It helps cover preventive services, doctor office visits, outpatient surgery, lab tests, x-rays, CT scans, MRIs, durable medical equipment such as diabetic testing supplies, and Part B drugs such as chemotherapy. With Part B, you pay a premium, a deductible, coinsurance, copays. $164.90 is the monthly standard Medicare Part B premium in 2023, generally deducted from a Social Security check. The monthly Part B premium varies for high-income enrollees. $226 is the 2023 annual Part B deductible before Medicare pays 80% for most Part B services. There is no maximum limit on Part B out-of-pocket costs. IRMAA, IRMA. It's an income-related monthly adjustment amount. What is it? For 2023, it is a surcharge added to the Part B premium and Part D plan for individuals making more than $97,000 or couples who are filing jointly making over $194,000 a year. The surcharge is assessed based on your MAGI, or modified adjusted gross income, from 2 years prior. If your income was higher 2 years ago, and now your income is significantly lower due to a life-changing event, you may be eligible to appeal the IRMA, and details can be found at www.ssa.gov, and that's the Social Security Administration. You have to pay the IRMA for your Part B and D. This is the Medicare premium by income chart for 2023. Medicare looks at your modified adjusted gross income, again, usually 2 years prior to the current year. For example, in 2023, they look at your 2021 modified adjusted gross income. The Part B premium and income considerations adjust annually. Original Medicare alone may not be enough. Here are some examples of costs one may incur with Original Medicare. A one-day hospital stay, $1,600, which is the Part A deductible. 150 consecutive day stay in a hospital, $60,400. 100 consecutive day stay in a skilled nursing facility, $15,800. Doctor visits and outpatient surgeries, a $226 Part B deductible, plus 20% coinsurance with no out-of-pocket limit. Other items that Original Medicare does not cover: most prescription drugs, which can be addressed with a Part D plan, routine vision, dental, or hearing care, and extended long-term care. As we learned in prior slides, Original Medicare does not cover everything, so there is value in exploring additional Medicare options to protect against unforeseen medical costs. What are some of the options? Medigap, also referenced as a Medicare supplement. Medicare Part C, also called a Medicare Advantage plan. And finally, Medicare Part D, which is a prescription drug plan. Good questions to consider. Can I keep my providers, doctors, hospitals, and pharmacies? What will my medications cost? Are there restrictions in medications? Any expected surgeries or procedures upcoming? And are dental, hearing, and alternative care coverage important? There are 2 avenues to secure additional coverage. First, a Medigap or supplement plan. These are designed by the federal government and administered by private insurance companies. Like the 4 parts of Medicare, Part A, B, C, and D, Medigap plans are identified by letters ranging A through N. They provide coverage for some health care costs that Original Medicare alone doesn't cover, such as copays, deductibles, or coinsurance. Medigap plans pay secondary to Medicare on a Medicare-approved expense. If Medicare denies a claim, the Medigap plan does not pay. You must be enrolled in Medicare Part A and Part B before you can enroll in a Medigap plan. Medigap plans do not include prescription drug coverage, but you can purchase standalone Medicare Part D coverage. Medigap plans are not tied to a provider network such as a PPO or HMO. A participant may use providers that accept Original Medicare. Some plans also have a foreign travel emergency benefit. If you purchase a Medigap plan, you pay a monthly premium. Many Medigap plans have a lower out-of-pocket cost than other Medicare options. However, the premium usually costs more than a Medicare Advantage plan. The next option are Medicare Advantage plans or Part C plans. They are health plan options approved by Medicare and are run by private insurance companies providing your coverage. When you choose to enroll in a Medicare Advantage plan, you choose to have a private health insurance carrier administer Medicare for the federal government. They provide your Part A hospital insurance, Part B medical insurance, and cover all the medically necessary services that original Medicare provides. They can also cover additional benefits like vision, dental, and hearing. Medicare Advantage plans may have co-pays for services. They also have an out-of-pocket maximum to protect you. Medicare Advantage plans usually include Medicare prescription drug coverage. Everything is bundled into one plan with one card that you can use at the doctor, hospital, and pharmacy. Medicare Advantage plans with prescription drug coverage usually have a lower premium in comparison to enrolling in a Medicare Part A, B with a Medicare supplement and an additional Medicare Part D prescription drug plan. Let's talk about the coverage differences between Medigap and Medicare Advantage plans. Medigap covers cost gaps of original Medicare. May be able to add extra benefits with benefit riders. Add drug coverage with a standalone Part D plan. They are portable within the U.S. Plans are all standardized. You can see any provider who accepts Medicare. Premiums are higher on average. MedAdvantage plans are Part C. It replaces original Medicare. Plans often include extra benefits, must change plans if moving outside of a service area. Some retiree Medicare Advantage plans may not require that change. Plans vary by carrier and area. Must use providers in a plan's network for lowest cost. These may be HMO or PPO networks. Lower average monthly premiums. Both Medigap and Medicare Advantage require one to enroll in Medicare Parts A, B, and pay the Part B premium. Medicare Supplement or Medigap plans. You will find the premiums will vary by carrier. The Medigap or supplement plans are designed to close the gaps in original Medicare, often covering copays, coinsurance, and possibly deductibles. You're not limited to provider networks. You may utilize any provider who accepts Medicare. Medigap and supplements offer a choice of standardized plans to select from. The benefits will vary by plan. You will find insurance carriers may offer varying plans, and Medigap supplements do not cover prescription drugs. Medicare Part C or Medicare Advantage plans. What do they cost? The plans may have a monthly premium, copay, and coinsurance. Additionally, you must continue to pay for your monthly Part B premium. Well, how do they work? Remember, you must be enrolled in Medicare Parts A and B. Medicare Advantage are Medicare-approved plans from a private company that offers an alternative to original Medicare for your health and drug coverage. These bundled plans include a Medicare equivalent to Part A and B, and usually include a Part D plan. There are many types of Medicare Advantage plans, which include Preferred Provider Organizations, PPO, Health Maintenance Organizations, HMO, Private Fee-for-Service Plans, PFFS, Point of Service Plans, POS, and Special Needs Plans, SNP plans. Medicare Part D Prescription Drug Plan. What does it cover? The premiums will vary by plan, and what you pay will be dependent on the medications and quantities taken. There are phases in the Part D coverage, and we will discuss more shortly. Lower income individuals may qualify for extra help. How do they work? The plan covers Part D prescription drug costs. There are typically two ways to purchase a Part D plan: standalone with Original Medicare, or choose a Medicare Advantage plan that includes a Part D bundled with it. What does it cover? Benefits and drugs vary by plan, so one should review their specific circumstances carefully. The stages of Medicare Part D coverage. Stage 1, deductible. Member pays full costs until the deductible has been met. Stage 2, the initial coverage stage. Member pays a copay or coinsurance for each prescription. The initial coverage continues until the total drug costs paid by the member and plan reach $4,660. Stage 3 is the coverage gap. The member pays no more than 25% of the cost for brand name and generic drugs covered by the Part D plan. Please note the full cost of the drug will be used to move you closer to the catastrophic stage. Once a member has spent $7,400 in out-of-pocket, they move to Stage 4. Stage 4, the catastrophic. The member pays the greater of 5% or $4.15 for generic drugs, and the member will pay a greater of 5% or $10.35 for brand name drugs. The best times to enroll so you can avoid penalties and get the type of plan you would like. To enroll, there are several opportunities to enroll in Original Medicare if you are not automatically enrolled. Enrollment in Original Medicare Parts A and B is automatic if you are receiving Social Security before age 65. IEP, the initial enrollment period, is a 7-month window that begins 3 months before your birthday month, runs through your birthday month, and the 3 months after. You can apply for any type of Medicare plan: Original Medicare Parts A and B, a Medigap, a prescription drug plan, Part D, and a Medicare Advantage plan, Part C. AEP is the annual election period and is another key enrollment period that occurs each year from October 15th to December 7th. This period is specifically designed for those enrolled in Medicare Advantage plans who wish to change their coverage. This can include enrolling in different Medicare Advantage plan, switching to Original Medicare, or enrolling in a prescription drug plan or making changes. OEP, the open enrollment period, is a time when anyone eligible for Medicare can enroll in, change, or unenroll from Medicare Advantage plan or prescription drug plan. This period typically occurs each year from January 1st to March 31st. SEP, special enrollment period. You can make changes to your Medicare Advantage and Medicare prescription drug coverage when certain events happen in your life, like if you move or you lose other insurance coverage such as employer coverage. If you did not sign up for Part B when you were first eligible due to having employer coverage, you can sign up during this period. This 8-month period starts the month your employment ends or the month your coverage ends, whichever comes first. Past 65. Some enroll in Part A when turning 65, even when continuing to work or having employer coverage. Most delay Part B enrollment to avoid paying Part B premiums. If you work past 65, you may be able to delay enrolling in Medicare without penalty if the employer has 20 or more employees, you are covered by your employer's or spouse's employer group health insurance, not including COBRA. The employer has creditable prescription drug program. Part B, late enrollment penalty. How much is the penalty? A permanent 10% penalty added to your Part B premium for every year you could have enrolled and did not. A 2-year delay would be a 20% penalty added to your Part B premium for as long as you're enrolled in Medicare Part D. How can you avoid the penalty? Enroll in your Part B when you're first eligible. Enroll in your Part B within 8 months of losing your employer coverage or stop working, whichever comes first. Enroll in other employer coverage, such as a spouse, if you're eligible. Part D late enrollment penalty. How much is it? A permanent 1% penalty would be added to your Part D premium for every month you could have enrolled but did not. A 10-month delay would equal a 10% penalty added to the Part D premium for as long as you have a Part D plan. How can you avoid a penalty? Enroll in your Part D when you're first eligible. Enroll in your Part D within 63 days of losing other creditable drug coverage. And a little reminder, obtain and keep records showing that you had creditable drug coverage and give them to your plan if requested. How do Medicare and health savings accounts work together? Once enrolled in Medicare, you can no longer make HSA contributions. If you plan to work past age 65 and plan to contribute towards an HSA, do not enroll into either Medicare Part A or B. You will need to stop making HSA contributions at least 6 months prior to enrolling onto Social Security. Individual and family health insurance plans. Once you become Medicare eligible, you cannot choose to enroll in an individual or family plan. You no longer qualify for premium tax credits. You may lose coverage at the end of the year. You need to drop the individual and family coverage prior to Medicare coverage begins to avoid overlap. How to enroll in Original Medicare, Medicare Parts A and B. You may call the Social Security Administration at 800-772-1213. You may visit a local Social Security Administration office, or you may apply online at www.ssa.gov. How to enroll in a Medigap or MedAdvantage plan? Please email or give me a call, Mike Jacqueline. I'd be honored to assist you. You'll need to have your Medicare A and B in place before applying for a Medigap or MedAdvantage plan. I sincerely hope this high-level review was helpful. It may have even triggered some additional questions. Please call or email me. Let's set up a time to discuss your specific questions and needs. Thank you.